In order to send blood to the foot, the left ventricle will pump blood into the ascending aorta, into the arch of the aorta, and then through the descending aorta. Now, the descending aorta can be broken into sections. It can be referred to as the thoracic aorta, while it is in the thorax. And then after passing through the diaphragm, it can be called the abdominal aorta. The abdominal aorta will divide around the level of the hip, beginning with the bone called the ilium, and here it divides into the common iliac arteries. The abdominal aorta branches at the region of the hips, or the ilium, to form the common iliac arteries. These common iliac arteries then branch to form the internal iliac arteries, which will go into the pelvic cavity and service the pelvic organs. And the external iliac arteries, which after passing through the body wall becomes the femoral artery traveling through the leg. And so in order to reach the foot, blood will go from the abdominal aorta through the common iliac artery, the external iliac artery, and then finally the femoral artery. After the abdominal aorta bifurcates, it forms the common iliac arteries here and here. These common iliac arteries will split to an internal iliac artery, which services the organs of the pelvic cavity, and the external iliac artery. As the external iliac artery leaves the pelvic cavity and enters the leg, it is now renamed the femoral artery. The femoral artery will pass through the adductor muscles, and as it passes behind the knee is known as the popliteal artery. And then upon reaching the lower leg, it becomes the tibial arteries. So this one artery is given several names depending on its position. The common iliac artery, the external iliac artery, the femoral artery, the popliteal artery, and then finally the tibial artery. The external iliac artery will leave the body wall and will then go into the leg. As such, it is now renamed and called the femoral artery as it travels here, obviously along the upper leg where the femur is located. It will begin to penetrate the adductor muscles and one of the hamstrings, and as it does so, it will disappear. In the cat, you will have to dissect this, and it will go past the condyles of the femur on the posterior side of the knee. Here it is known as the popliteal artery. So the femoral artery will become the popliteal artery behind the knee. In the lower leg, the popliteal artery will then split into tibial arteries. The popliteal vein behind the knee will then travel through those adductors, as did the artery, and then become the femoral vein as it travels towards the body wall. Blood returning to the heart will pass through the femoral vein, go through the body wall, where it becomes the external iliac vein. The internal iliac vein, coming from the pelvic cavity, will fuse with the external iliac vein, and together will form the common iliac veins, just deep to the arteries. These common iliac veins will fuse to form the inferior vena cava, which will travel then through the liver and to the heart. The great saphenous vein is an alternate route for blood to travel from the foot through the lower leg and through the thigh, where it will join to the femoral vein. The great saphenous vein is the longest vein in the leg. The femoral vein will pass through the body wall, becoming the external iliac vein. When fusing with the internal iliac vein, it becomes the common iliac vein. The common iliac veins, left and right, will fuse to form the inferior vena cava, which will then pass through the liver and travel into the thorax, where it will empty into the right atrium.